A Salt Lake woman has become the first Utah patient to get a new disc implant in the upper part of her spine, her neck. The implants were approved by the FDA only 3 months ago. Ed Yates joins us now with more on this story.
Well, Deanie, we've had disc replacements for the lower part of our back, this lumbar region, for the past 2 years, but never for the upper, narrower part of the spine in the neck. The only visible sign of surgery on Tammy Kaiser is a small 1-inch scar on her neck. A herniated disc in the C5-C6 region of her spine was pinching the number 6 nerve, sending severe pain and numbness down her arm. At the time, Tammy didn't have many options.
Pretty much fusion. Pretty much, we tried the cortisone, we tried different options. That way it didn't work. Pretty much fusion was the only option that I thought I had at that point.
But instead, Dr. Armen Khachatryan at Jordan Valley Hospital implanted a new FDA-approved disc designed specifically for this region of the spine. Through an incision in the front of her neck, they cut and removed the ruptured disc, polished and tuned up the bone on either side, then filled the void not with a fused bone graft, but a movable ball and socket metal disc that allowed the 2 segments of her spine to move independently. Tammy had the replacement procedure in a surgical suite much like this one. It took about 2 hours. She spent the night and then went home the next day.
I went and saw her the same day in the hospital. By later in that afternoon, she was sitting comfortably. Her arm pain was completely gone. She had a little bit of soreness in her neck where we did the surgery, but by next morning she went home and she went back to work within 10 days.
How quickly medical technology changes. 6 months ago, Tammy's spine would have been fused. But with this new disc, does she lose any mobility?
I don't think I've lost any. I haven't noticed any restriction, nothing. I just felt like they gave me back my life again.
In earlier performance tests in the lab, the new disc went through 20 million movement cycles with no apparent wear and tear. So Dr. Khachatryan says the replacement should last Tammy's lifetime.
Another amazing medical story. Thanks, Ed. There's a malicious...